started with our argument by talking about the economic burden of colorectal cancer, because one of the things we're asking is people to do something for free, and we needed to justify really what was going to be our return. And so we know that by 2020, colorectal cancer will have a burden of about $14 billion in the United States. Efforts at reducing the economic burden focus on access and preventing late-stage and costly presentations. So who are we leaving behind next year? Is there someone we can afford to leave behind in this fight? Absolutely not. In 2013, 30% of uninsured adults went without needed medical care. And 40% said that they had outstanding medical bills. A fifth of the patients said that these generate significant financial strain to their organization, to their lives. And so we looked at, particularly in the state of Kentucky, we had a very successful rollout, okay, of the Medicaid expansion. And we looked at what was the impact. This is the ACA's national impact. But I will tell you that in the state of Kentucky, we really got behind this idea. And we saw our rates of uninsurance fall. They're actually now down about 7.6% because of our expansion. I met with the Kentucky State Commissioner of Public Health and I said, hey, if we're all covered and you don't need me, I got other things I can do. What do you want me to do? She at that time said, please continue. Please continue. We still have people in the gap, and that represents patients who are ineligible for Medicare and Medicaid, as well as underinsured people. So here's American insurance status by the percent, and you can see that a surprising percent, up to 23% of people are uninsured. But the underinsured represent, that should be under 23%, okay? But unregistered and uninsured up there are about 1%. For a total of roughly 25 to 30% of Americans are going to fall into the gap of uninsured or underinsured, unable to afford their insurance premiums. I'll talk to you about how we define that for our organization. So in Kentucky, the impact of having no insurance is that you are more likely to be diagnosed with colorectal cancer. Your odds ratio is at 2.2 over the insured population. And we found that even within our state, patients with Medicaid have more than a 60% increase in their odds of being diagnosed with late-stage disease. Late-stage disease is stage 3 or stage 4. Okay, it's outside the mucosa, it's into the colon wall or into the surrounding tissues, or distant disease. So how are we preventing colon cancer in the gap in our state and in our city? So our hypothesis was that giving away colonoscopies would actually detect late-stage disease early, would detect an earlier in the process, so make it earlier stage disease, and be cost-effective. So our argument was that giving away colonoscopies would actually save us money. So I'm going to describe our first year to you, and then I'll tell you some specifics about our program. So our first year, we partnered with the Kentucky Colon Cancer Prevention Project. It was funded by the state of Kentucky, where we saw where we sat in the nation with colon cancer screening. We were 48th, we were not proud of that, and so our state funded the CCPP. They partnered with us, Surgery on Sunday. Let me tell you what that meant. That meant that Whitney Jones called me and he said, hey Erica, Lexington has this program called Surgery on Sunday. We need to have one here in Louisville to do some colonoscopies, and we need a medical director. I'm in clinic, I say, sure, whatever you need. There was no organization, there was no Surgery on Sunday in Louisville, and so we started that program. And we started by giving free colonoscopies. So how does Surgery on Sunday work? We get referrals. We are a nonprofit. We will get referrals from community health